Hi everyone. Last week we asked you to post your comments and questions about Botox and filler on social media so that we could come back and answer them for you. We actually didn't get a lot of questions, so I thought I would just go through some of the common questions we see here when people come in for a consultation at Renew. So for Botox, people often ask things like, will I have side effects or problems with Botox? How long does it last? How long do the injections take? How long does it take for the Botox to kick in? Is there a difference between Botox and Xeomin and Dysport and some of the other products that are out there? So Botox injections are not painful. We use a small insulin syringe to do the injections. So you feel a little bit of a pinch, but that's about it. Afterwards, you can have a little bit of redness or bumpiness at the injection sites, but that normally goes away within, a few minutes to an hour after you've been injected. The Botox takes about 2 weeks to kick in. You can start to see results in as soon as 3 or 4 days. So we typically ask people to give it the full 2 weeks before they decide if they like it or if they need a touch-up. If you're new to Botox or new to us, it's not uncommon to need a touch-up for Botox. The most common area that gets touched up is the forehead. And, when you're new to us and we're trying to figure out how many units to give you and what you need, sometimes in the beginning we'll give you a little lighter dose, and then you may have to come back in to get a touch-up until we kind of learn your face and figure out, exactly what dosing you require. And then Botox usually lasts for about 3 months. So we recommend that you come in every 3 months to get your treatments. If you're really, wanting to reduce wrinkles or have concerns about, long permanent, wrinkles and lines, doing those treatments every 3 months will help to prevent that. And then I guess the last thing was the difference between Dysport, Botox and Xeomin and some of the other products out there. So, we have Xeomin, Dysport, and Botox here. Dysport, their claim to fame is that the molecule is smaller, it gets into the muscle quicker, so it kicks in a little bit faster. And in some people, they say it can last a little bit longer. So, up to, 4 to 6 months. Xeomin, that is marketed as the most pure form of Botox. Does not have an accessory protein on it, which some of the other products do, that helps to transport the Botox or the toxin into the muscle. So Xeomin does not have that, and it is said to be better for people maybe who have allergic reactions to medication and things like that. It is also thought to be better for people who exercise, that maybe because that accessory protein is missing, that it might not metabolize as quickly as some of the other products. That's really kind of the difference. Although what I can tell you is, we have some clients who certainly have a preference between one or the other. I'll have people who say Botox and Xeomin don't work for me, I need to do Dysport, or Botox and Dysport don't work for me, I have to do, Xeomin, and the same, Xeomin and Dysport don't work for me, I really like Botox better. And then I have other people who say that it really doesn't make a difference if they've tried all three and they don't really see a difference in any of the treatments. So, you're welcome to try, one or all of them and see what works best for you. They're all pretty similarly priced, and you can give them a try and kind of decide what you think is best for you and what you need. And then as far as filler goes, the common questions regarding filler are similar. How long does it last? Will I see results right away? Am I going to have any side effects or problems? Oh, and I forgot to mention, with Botox, side effects or problems, the most common thing I would say is bruising. And although I'm saying it's common, it's not something that we see that often, but you can get little pinpoint bruises when you get injected with Botox, especially around the eye area. That area is very vascular, so people can easily bruise there. If you do get a bruise, we know it right away. Usually we can see it at the time of injection, and it's small and can be covered up with makeup, and it'll go away within a couple of days. The biggest concern about Botox is having the Botox move, or Xeomin or any of those products, is having it move to an area where we don't want it to be. So, we typically will tell people, you want to make sure that you have an injector who knows what they're doing, that they know the proper sites to inject and things like that, and the amounts that they should use. And you also, there are a few instructions that we ask people to follow after they're injected to minimize the risk of those kind of complications. So, if you're getting injected in this area specifically, if you're not careful, Botox can migrate into the eyelid and cause the lid to droop a little bit. Sometimes if the forehead is injected too low or too heavy, it can cause like the brow to sag down. So, we ask our clients not to lay down for 4 hours after they're treated, not to exercise the day that they get treated, not to put pressure or manipulate those areas that have been injected, so that we're sure that the neurotoxin stays where we put it. There are a small percentage of people, very small, I want to say less than 1%, who are injected properly and they're still an issue, although we have not seen that here. I have seen, on social media and things like that where those kind of things have happened. But typically if you have a skilled injector who knows the injection sites and what they're doing, you don't have those kind of complications. Okay, and then back to filler. So same kind of questions with filler, how long does it last? Will I see results right away? Any side effects or problems, things like that. So with filler, the difference between Botox and filler is, with Botox, you're using that to reduce wrinkles, usually primarily in the upper face. Although you can use some Botox around the mouth to flip the lip or to, minimize the smoker's lines around the mouth, things like that. You can also use some Botox in the lower jaw, for the masseter muscle to kind of debulk that. And then you can use some Botox here to stop the mouth from pulling down a little bit. So those are some of the other ways that we use Botox and Xeomin and things like that in the lower face. But primarily the lower face, we use filler in the lower face. And the difference between the two is that filler is really used to improve lost volume, while Botox is being used to treat wrinkles. So common places for filler, the cheeks to give a little lift here, nasolabial folds, although a lot of times when we lift up the cheeks, we don't really have to put much filler in the nasolabial folds, and a lot of times we try to avoid putting a lot of filler here because we don't want to give people a full or round kind of like monkey face there. So we try not to do too much here. We always kind of start with, does someone need volume in the cheeks to lift things up a little bit? And then if we have to go back and fill some of the superficial lines around the mouth with filler, we can do that. Filler can also be used around the jaw line. If people have kind of a jowly look, you can use some filler to fix that. And certainly, in and around the lips, fillers used there too. Side effects or problems with filler. Bruising can happen with filler, although again, it's not a super common occurrence. It does happen sometimes where people will get a bruise. The biggest concern with filler, and again, why you want to be seeing an injector who has experience and knows what they're doing, is that, filler, if it's injected into a vessel, a blood vessel, can cause a serious complication. So like here at Renew, we take precautions to prevent that. We're pulling back on our syringes to make sure we're not seeing blood before we're injecting, and really examining the area while we're doing the treatments. And you do see results with filler right away. So people, they get injected and they can see right away the difference. You do get some swelling for, a couple of days after you've had it. So again, with filler, we tell people like give it 2 weeks, for it to integrate completely into the tissue, and then you can decide if you need more, based on how those results look, in a couple weeks. Occasionally you can get lumps or bumps with filler, again, we take care to, massage the areas and make sure if there are any bumps or nodules that we're, rubbing those, and, making sure that they're kind of dissolved before you leave. And we tell people to kind of keep an eye on things, and if there are any problems, we want to hear from you right away. Although, like I said, most people do very well. I have seen an occasional allergic reaction to filler. We've seen that happen once or twice here at Renew in the last 5 years. And that can be treated typically pretty easily with a steroid pack. If you do have an allergic reaction, which usually manifests itself as swelling or itching in the area, we typically don't want to re-inject you if you've had something like that happen. So those are the answers to the commonly asked questions and things that we see here at Renew. Certainly, if you're interested in either Botox or filler, we do free consultations here. So you're welcome to come in and talk to one of us and get some information. And if you have any other questions, please, leave them below and we'll come back and answer them later. Okay, thanks. Have a good day.